Good evening, everyone. I'm Dr. G. N. Ravi Patel, consultant nephrologist and transplant physician working in Surgical Specialty Hospital, Shimoga. Today, I'm talking about chronic kidney disease and pedal edema. Let me start. Like, what is the functions of kidney? Kidneys are very important organs in the uh, crosstalk between the multiple organs that functions in the form of maintaining the water and sodium electrolyte homeostasis and acid base balance, as well as production of hemoglobin by synthesizing the erythropoietin, and mineral bone metabolism by synthesizing vitamin D, as well as other important factors like FGF23, as well as the clotho. Apart from these things, they also function in the form of removal of excess toxins in the body, which is very important, metabolic waste of the body. So these are very important functions. And like, what is CKD means, any abnormality in the kidney function, either in the form of structural or functional. Structural, like in the form of like cystic kidney disease or any scars, or functional in the form of reduction in the GFR for a more than 3 months duration. Any of these structural or functional for a more than 3 months duration, it is called chronic kidney disease. So once the kidney functions deteriorates, what are the symptoms? We can say that in the very early beginning stage, there will be no symptoms. Like majority of the patient, like very common people, like up to a few rise in the creatinine. Once the creatinine progressively rises, or sometimes apart from like rising creatinine, persistent proteinuria, there starts a symptom swelling of the body, tension of fluid and water, sodium in the body. They may cause swelling of the limbs as well as the body, sometimes predominantly the face on lying down position. And apart from these symptoms, as the kidney disease progresses, they may experience easy fatiguability due to decrease in the hemoglobin production, nausea, vomiting because of the rise in this bony weakness, bony pains, skin abnormalities. These are like various problems once a chronic kidney disease initiates, and these symptoms vary from the stages of the kidney disease, and these stages are called KDIGO stages. This is mainly based on the EGFR as well as the albuminuria. This coming to the EGFR, which is very important. Anything like between the 60 to 90 GFR ml per minute for body surface area, it is stage one, and by 45 to 60, it is called stage two. By 35 to 45, it is called stage 3, and 15 to 30 ml per liter body surface area is stage 4, and less than 15 is called stage 5. Anything less than 5 is called end stage kidney disease. And coming to the predominant symptoms of this chronic kidney disease is the pedal edema. The main reason behind the pedal edema is once the filtration capacity of the kidney is decreased, there will be mechanism of edema is mainly in the form of retention of the sodium, because kidney can't excrete the sodium more in the kidney. So that will, in fact, it will cause more retention of the water, and that will cause the accumulation in the third space fluid, and they will cause the swelling of face or limbs, even if the severe grade 4 and the fluid accumulates everywhere, chest, abdomen, and everywhere. And other mechanism of the edema is in the nephrotic syndrome or massive proteinuria in the CKD, especially diabetic kidney diseases or like proteinuric diabetic kidney diseases, where there will be massive proteinuria that will cause decrease in the oncotic pressure, and this all fluid will go to the third space, and that will cause the swelling of the body or the lips or face, everything. And coming to the management of this uh, edema, pedal edema in the chronic kidney disease, first and foremost important is the assess the stage of the kidney disease and root cause of the edema, whether it is proteinuric edema or mainly the fluid retention or sodium retention, as happens in progressive CKD. Once you address, and you can treat like the specific proteinuric edema, and treat the cause of proteinuria like nephrotic syndrome, or decrease the proteinuria, automatically edema corrects. And second thing is uh, the dietary management. That is more important, is reduction in the salt intake, total salt intake. That is in the form of you should decrease the salt intake to less than 3 grams per day. And the third thing is decrease the fluid intake also. Like if you more water, or it can't be filtered more, and water intake that should be reduced based on the patient will be tell around 1 to 1.5 liter per day. Apart from this fluid and salt intake reduction, the most important is the diuretic. There are many classes of diuretics which are like the market, and we use depending on the patient and side effect profile. And these diuretics like can be given maximum dose, and apart like they will increase the free water clearance, that in turn will decrease the edema. Apart from the diuretic, is a like use of compression stockings also is more important. That because the chronic edema will cause stasis, sometimes that will cause cellulitis or a ulcers that in turn will cause the worsening of the CKD in the early CKD patients. So better like use of stockings will very help in the symptomatic management. Third is like positional change in the body system. Like if the edema is more, you raise your limbs at the while napping, keeping the pillows or foot and elevation, that will also cause reduction in that. These are only symptomatic reduction. Uh, the main is the dietary and diuretic use is very important thing. Apart from treating the other supportive care like use of SGLT also increase the uh, sodium excretion that will come because the fluid reduction in the body. And other specific treatment like using the reduction of proteinuria by using the ARBs or the inhibitors, or specific treatment of the nephrotic syndrome also helps. If the edema is like very difficult to manage with all the medical management and use of drugs, then the ultimate is the patient may require renal replacement therapy, that is in the form of either hemodialysis or uh, peritoneal dialysis, or may go for renal therapy. Thank you very much for giving this opportunity to talk on the CKD and fidelity. Thank you very much.